eye floaters. It is a pretty common symptoms what the patient uh, many a time complains. Eye floaters are like these are like spots in the vision. It might look like a string or a cobweb like thing which floats in the front of the eye. It actually, one can see these floaters when they move their eyes, something like they will complain that something floating, some particle floating in front of the eyes. So, these are like floaters. There is a jelly like thing which is called the vitreous, which is inside our eye. So what happens with aging is this jelly gradually liquefies. So whenever it liquefies and this jelly is attached to the inner side of the eye, which is called the retina, and it this jelly detaches from the retina, which is called the PVD, that is posterior vitreous detachment. So first of all, the jelly liquefies, then it contracts and moves away from the retina. It detaches from the retina. So this is the main cause when one experiences floaters. Now, there are other causes of floaters as well. Uh, Patients or individuals having myopia, that is, one who cannot see the distant, or in a very gross language or layman language, we can see if somebody has a minus power. These are the patients who actually frequently has the symptoms of floaters. And these are the aging is the most common. Next to aging is myopia. And the other causes, like if somebody gets an eye injury, or there is some inflammation or some reaction to the eye, which we say that it's the uveitis, the posterior uveitis, or the inflammation of the middle part of the eye, that also causes floaters, or there is some bleeding inside the eye that can also cause floaters. And there are some iatrogenic causes of floaters, that is, if there is some surgery, that some injection is given inside the eye, that can cause floaters, or if silicon oil is introduced to the eye, the silicon bubbles one can see as the floaters. So these are the various causes of floaters. Patients with a minus power do have little bit of floaters, and it has been there for many years. In those cases, generally they get used to it and there is no problem as far as the vision is concerned. But when there is this aging thing, the suddenly the vitreous gets detached from the retina, and it's just in front of the eyes, then the patient gets a blurred vision. So, and that is the stage where the patient will have difficulty in vision. Otherwise, little bit of floaters doesn't cause a difficulty of vision. The liquefaction of jelly will happen to everybody. Somebody experiences early, somebody experiences later on. So it's a natural course. This vitreous will liquefy. It's a degenerative process which occurs with aging. In myopia also, it happens with a lot of minus power patients, myopic patients. We cannot prevent this to happen. Like, it will happen. It is a spontaneous thing which will happen, and it will go off spontaneously. So there is no way we can prevent floaters from patients or myopia or an age-related vitreous degeneration. So mostly it is a spontaneous phenomenon. We cannot prevent by medicine or any surgery. Floaters is an symptoms which, as I was mentioning, it might be symptoms of some disease like a retinal detachment or a vitreous hemorrhage or posterior uveitis, apart from a regular floaters which might be there in the myopic patients. A regular floater in the myopic patients doesn't need to be worried about. One should not be worried about, because it will go off, or a little bit of will be there, but it will not cause any harm to the eye. But at the same time, when there is floaters due to retinal detachment, or a vitreous hemorrhage or in posterior uveitis, we have to treat those underlying disease. Retinal detachment is an ocular emergency. We have to address the retinal detachment as soon as possible. Otherwise, it might lead permanent blindness. As far as vitreous hemorrhage is concerned, we have to see why the hemorrhage, why the bleeding has happened, whether it is due to some diabetes or underlying some pathologies in the eye. We need to treat those. Sometimes conservatively with medicines, we have to treat the vitreous hemorrhage. If it doesn't go, it is a non-resolving vitreous hemorrhage or vitreous bleeding, then we have to do a surgery. As far as the posterior uveitis is concerned, we have to treat with steroids. So there are different reasons for the floaters, and depending on the underlying disease, we have to treat accordingly. The floaters is like sometimes a warning sign of some diseases. The most important is a retinal detachment. And a retinal detachment, as I was mentioning, some individual will have little bit of floaters, but all of a sudden, if this floaters increases or it is accompanied with flashes of light, then one has to be very cautious that the underlying there might be some retinal tear or a retinal detachment, or a vitreous hemorrhage also can give rise to increase in floaters. Inflammation also does the increase in floaters. So, in a nutshell, I would say that little bit of floaters in a myopic patient might be normal, but all of a sudden, if there's an increase in floaters or associated with blurring of vision or flashes of light, is something which is a warning sign, and one should be consulting a doctor, because we need to rule out a retinal detachment, vitreous hemorrhage that is bleeding inside the eye, or an inflammation of the posterior part of the eye.